Mr. Chairman, I don't have any presentation to make. I would just like to talk about what just Dr. Nagpal has concluded: reform, transform, and perform. I come from NABH, which is an accreditation body, and accreditation to me is actually the improvement program for any healthcare provider in different healthcare settings and healthcare facilities. And like Dr. Nagpal said, that we just begin to start some changes made in our system which can improve our services, which can be used as a tool for the improvement of different services being offered in the healthcare providers facilities. What I want to say is that reform in the shape of improvement, in the quality improvement or the improvement in the services which you are delivering as a healthcare facilities, had already started transforming the delivery part of your services. And this, how I can say, is based on the satisfaction level of the, the patients, who are the customers for the healthcare facilities, which we have with, of course, with limited data of around 40 hospitals when we did this study, that this has created a platform for the healthcare facilities to look at the systems which they are employing in your hospitals and different settings, that how they can improve. And improve means how they can work towards a flow that which takes from one step to another step to the next steps. Because you cannot jump from one step to third step directly, so you have to have a stabilization process in place. And this reform and things, transformation, actually, you just mentioned about the performance. We look for the performance. The performance measures the key indicators, how you measure your performance, which are defined by yourself. You define your own performance measures, you define your own indicators, and you start working on that, and then you measure at next level where you are. So we give a guidance to the healthcare providers that these are the indicators you might like to choose for your performance measurement, and leave up to them that how they do that. We of course provide a methodology to do that, so that we get the data to analyze statistically and come out with the conclusion that yes, what measures need to be taken more to improve at a level of performance. So this performance measurement, performance journey, quality improvement paths, clinical governance, and the role of information technology integrated with all these processes. Because there's a tool which actually provides a platform to the facility to improve on the process, minimizes the errors, and work more efficiently. But it's not a mandate from our side. Somebody might choose to have hard copies in the system, might go paperless, or maybe a combination of both paper and paperless system. But the main thing comes in this, when you adopt a totally paperless system, you have control over information technology tool which you are using. This comes how you protect it. How you make sure that the data which is being entered, generated, and giving you the reports is protected from unwanted, penetration systems. And that's why we talk on this stage that how you protect your data, not only for your own purpose, which you are generating, but of course for the side of the patients, because the confidentiality of the data of the patient is very important. And how you share this data amongst clinicians, the question sometimes comes, when you use different processes, reforms in a whatever way you say, in a hospital the question comes, a patient is seen by two doctors, whether both the doctors can see the prescription written by each other. Sometimes it's asked that whether this is confidentiality within these two doctors who are looking at the same patients. So these type of things which are coming up from time to time to deal with, and we are looking for the solutions, and these are solutions when we look over the different measures for discussion forums and conferences which generate the data for the discussion further. So performance for us is a key. Performance indicators, key performance indicators, which are KPIs, are defined, and we look at that. We are not going for, like you said, the public health basically is the key where most of the patients are dealing with. We started with our colleagues in our systems are working to define the standards for down the line healthcare providers, so that, and we are working with the government, Dr. Nagpal is aware, in J&K, to bring out certain reforms which can transform the lives of the systems and the patients which we are serving. So that's I can say on this very complex and crucial topics. If you have any questions at the end, I would be happy to answer that. Thank you very much.